viewers, welcome to Health Profile. Today we are here at Viranji Hospital. Dr. Hidayathulla is with us, consultant urologist. Hello doctor.
Hi.
Today we are going to talk about kidney stones. So doctor, what is kidney stone actually? How it forms?
Kidney stones actually there are different type of kidney stones are there.
Okay.
Mainly the kidney stones are formed because of our water intake habits and dietary habits, our weight, sugar, hypertension. These things are few causes for kidney stones. Kidney stones are formed because mostly in our area because of less water intake.
Okay.
Water intake is main reason for stone formation. Stones are mainly formed in the kidneys and they transfer from there to ureters and bladder. Depending on the position of the stone, the patient will have complaints. The kidney stones are chemically different types.
Okay.
They can be oxalate stones, they can be uric acid stones, there can be ammonia sodium stones, infection stones. These are different types of stones.
Doctor, are there any types of stones?
Yes, there are different types. Mainly what we see is uric acid stones and oxalate stones.
Okay.
These are main two types which general people used to know about and they present with.
What are the causes of kidney stone, doctor?
As I told you, this most commonly because of less water intake and our dietary habits. If the patient is having non-vegetarian diet and along with that he is taking less water, then they are prone to form uric acid stones.
Okay.
If the patients are taking vegetarian diets like palak, tomato, cabbage, and they along with that they are taking less water, then they are prone to form oxalate stones. So these are stones which are mainly formed because of less water intake. If the water intake is adequate, then the small stones which crystals which are formed in our urine, they will pass out in from the kidney. If you take less water, these small crystals will get aggregated and precipitated and form a layer by layer a stone. So that is the reason and cause for stones formation.
Okay. What are the signs and symptoms of it, doctor?
Signs is a good question. The patients usually present to us with the different complaints. Some present with passing of blood in urine. Most of them present with pain, severe pain which will start from loin region to groin region. And sometimes it may radiate to genital region also, the pain. And along with the pain they will have vomitings, profuse vomiting, sudden in onset. So sometimes if the patient is diabetic, some infection is there along with the stone, then they may have fever. Fever can be a presentation for them. These are some of the symptoms with which the patients usually present to us. The symptoms also vary with the position of the stone. If the stone is in the kidney, the symptoms will be different. If the stone is in the ureter, the symptoms will be different. And if the stone is in the bladder, urinary bladder, the symptoms are different. If the stone is in the bladder, for example, they will have frequency. More number of times they will go to the toilet. They will have burning sensation while passing urine. They will have blood in urine. Patient comes with a complaint that he is passing blood in urine.
Why so they present blood in the urine, doctor?
Blood in urine, they present because of the stone, because of friction.
Okay.
The stone will be rubbing the mucosa, inner layer of the bladder, because of which they will have bleeding in the urine. One of the reason. Another reason is infection, bacteria. The stone is itself is a good house for bacteria to live. So the bacteria can itself cause bleeding in urine, infections, inflammation and all.
What are the diagnostic methods you follow, doctor?
Usually as the patient present to us, we request them to get a ultrasound to know where exactly the stone and how the kidney is. Next is X-ray. X-ray we know, is it radio opaque or radiolucent? Stones are two types in X-rays. They are visible in X-ray, they are not visible in X-ray, depending on the chemical content of the stone. So we ask them to get an X-ray, we ask them to get an ultrasound,
Okay.
we ask them to get an simple urine test to know is there any infection in urine, and blood test to know how the kidney is working grossly, to explain the patient, and to plan our next investigation we ask them some blood investigations.
So what is the treatment for this kidney stones, doctor?
Treatment, there are different treatments available now with the different technologies developing, and it is developing day by day. It depends on size of the stone. If the stone is small and it is not troubling the patient, we can treat it with medicines.
Okay.
Sometimes if the stone is, for example, a patient comes with a report of 5 mm stone, these 5 mm stones we can treat with medicines. We advise them to take some medicines for 5 to 10 days. Usually with these medicines the stone will pass. If the stone is big and the patient is having symptoms, severe symptoms, then we have different treatments available depending on where the stone is. If the stone is in the kidney, the treatment is different, surgery is different, and if the stone is in the ureter, the treatment is different. If it is in the bladder, urinary bladder, the treatment is different. For example, if we take a kidney stone, the size of the stone is, a patient comes to us with a size of 1 centimeter stone in the kidney, then we have ESWL, shockwave lithotripsy, where we directly hit the stone with the shock waves. There it is non-invasive, just daycare procedure. The patient comes in the morning, we send them by evening.
Okay.
The stone will be broken from outside with shock waves. The other method is RIRS. RIRS is laser procedure, latest technique, where we use lasers, holmium laser, to powder the stone, and we place a stent to pass that powder. Another method is PCNL, where we make a small hole in the loin region, enter into the kidney, break into pieces and remove it. So these are basic, grossly if you say, the treatments which are available for the kidney stones. If it is in the ureter, then we do ureteroscopy, where we pass a small camera per urethra, we break the stone, we remove all the fragments. If it is in the bladder stone, then we break it into the bladder, that is called cystolithotripsy. If it is in the ureter, we call it as ureteroscopic lithotripsy, URSL. If it is in the bladder, then we tell it as CLT, cystolithotripsy. These are the grossly what are the treatments we use for the treatment of stones, kidney stones and other area stones.
After the treatment, do they need to follow any particular diet, doctor?
Yes, is a very good question and very important. See, most of the patients present to us with stones, we treat them, they forget about it. After 4 years, 40% of the people who have undergone treatment, they come with fresh symptoms of stones. So to prevent this, they have to follow some precautions. First and foremost important is water intake. Water intake should be adequate, neither more nor less, according to their requirement, according to their job. If the patient is a laborer, he is having lot of sweating, then his water intake should be more. If the patient is a clerk or sitting job, ID professionals, they require a specific volume. For example, a person, general people who are doing sitting job, they require 2.5 to 3 liters per day. So water intake is most important. If they maintain water intake, then the chances of stone formation and recurrence will be less. If they don't take adequate water, then the chances of stone recurrence after 4 years will be significant. That is most important. Second important thing is diet. If he is a non-vegetarian, he or she is a non-vegetarian, so he should avoid taking non-vegetarian diets. Excess should be avoided. Third is vegetarian diets. Vegetarian is, as I told you, palak, tomato, cabbage, cauliflower, sapota, grapes, kaju, cashew nuts. These are prone to form stones
Okay.
because of their chemical nature. They release oxalate, which is responsible for kidney stone formation. Every food has a oxalate. Even coffee and tea also have a oxalate. But these food items which I listed have more quantity of oxalates. So if you take these food items and less water intake, then chances of stone formation will be more. Same thing with non-vegetarians. Non-vegetarians, if they take more of mutton, chicken, red meat and they take less water, then uric acid will be more in their urine. So their chances of forming stones will be more. If they take these food items and take less water, then the stone will be forming. So what they have to do is decrease these food items and take adequate water intake. Then the recurrence chances will be less.
Would you like to give any take home message, doctor, to our viewers?
Yes, what I want to tell you is take adequate water. Even if the patient is not having stone, everyone requires some quantity of water. For example, if you take bathing, for bathing you require some quantity of water to clean yourself. Same way, you require minimum quantity of water to clean the body inside. That's 3 liters per day. If you take 3 liters per day, the inner body will be cleaned and the chemicals which are there in our food like uric acid, oxalate, which are taken through diet, will be cleaned. Otherwise, these chemicals, these crystals which get accumulated in the kidney will shape into a kidney stones. So my advice to you is take adequate water. Assess your water intake. Are you taking adequate water per day? It is 2.5 liters for a normal person. If the person is sweating a lot, then water intake should be adequately increased. And diet, if you are taking excess non-vegetarian diet, avoid it. Excess diet which is oxalate rich like palak, tomato, cabbage, avoid it. And along with that, if you are maintaining water intake, you can prevent kidney stones.
Thank you, doctor. Thank you so much.
Welcome.
What is exactly brain tumor?
You see, tumor means uncontrolled cell growth. If that happens in the brain, it is called as brain tumor. So suppose I say you all have got hurt or injured yourself, but you see after some time, even without any intervention, you recover. So that happens because the cell divides and they form their own cells and you have the recovery. But if this cell division or multiplication happens without control, it forms a tumor. And depending upon the location, you can have, if it is in the brain, it is called as brain tumor. If you have in the lung, then it is lung tumor or stomach. That is how it is. So this is simply, in simple terms, means a brain tumor.